Now, back to Coastal Living on KZTV.
This week on the show, we've been talking a lot about self-improvement and doing things that make you feel like your very best self. For some of us, that might be a breast reduction, which can have a lot of positive effects in your life. Let's talk to our friends at Coastal Cosmetics and Plastic Surgery to find out more.
Happiest procedures I do here at Coastal Cosmetic and Plastic Surgery Center are breast reductions. These are procedures that so many women notice gratifying results right away, and I frequently hear from ladies, I wish I'd done this years ago.
Many women contemplate breast reductions for both physical and psychological reasons. The common incentive for this procedure is associated with discomfort that most women experience prior to their surgery. A question women often ask is if they are qualified for this type of surgery.
Typically, ladies who qualify for breast reductions or who are coming to see me and wanting a breast reduction are ladies who have a lot of neck, back, and shoulder pain. They have grooving on their shoulders from their bra straps, difficulty finding bras and clothes that fit, or have problems even with exercising. Some ladies have difficulty laying on their back or even getting numbness and tingling down into their fingertips.
Each woman who has experienced a breast reduction has their own story to tell. And Dr. Cassidy Hinojosa can attest for these women, saying that it can change their lives for the better.
I really think that breast reductions can be game changers for women. So many ladies tell me how much it has improved their quality of life. Not only does it help with their back and neck pain, but it just overall makes them feel more confident. They look better in their clothing. It's easier to find clothing and bras that fit.
Let's face it, with any type of procedure, it's normal to feel nervous or have some uncertainty. Luckily for breast reductions, they aren't as painful as people might assume.
Everyone's a little different when it comes to postoperative pain, but I would definitely say that breast reductions are not one of my most painful surgeries. The reason being is I'm not doing anything to the structures that typically hurt, like muscle and bone. I'm just manipulating the skin. So although there is some discomfort, most of my patients are back to work within a couple of days.
Also, in case you didn't know, with this type of surgery,
and a breast reduction is actually a breast lift. So when I do a breast reduction, I'm removing that extra breast tissue, but I'm also lifting as well. This is why sometimes insurance companies can be sticklers when it comes to approving this surgery, because they do view it as cosmetic. But if we have the right criteria, I think oftentimes we have good luck in getting this approved through insurance.
Dr. Cassidy says that the majority of insurance companies stick to an algorithm based on your height and weight, also determining how much breast tissue should be removed. So if you're someone who experiences discomfort with back, shoulder, or neck pain, Dr. Cassidy Hinojosa still expresses this advice.
We know that extra weight on the chest, particularly with breasts, can definitely contribute to neck, back, and shoulder pain. But I always let patients know that, of course, if we have an underlying issue such as arthritis or a prior trauma, I can't guarantee that those symptoms will completely resolve with a breast reduction.
Now, if you think a breast reduction is something you might want to consider to better your quality of life,
I definitely encourage you to come in and have a consultation. We can talk about the surgery in detail, what all it involves. I can also let you know at that time if I think you'd be a good candidate for insurance, and if not, we can talk about out-of-pocket expense. If you're interested in a consultation, we'd love to see you here. Give us a call at 361-402-9819.
Wonderful information, and I hope that that was helpful to those of you at home who may have had some questions you might have been afraid to ask.